Hi all. So the talk that I wanted to give this evening is regarding the NHS and public perceptions of it. And what's triggered off this need to discuss this is seeing all these slogans everywhere claiming "I love the NHS." I'm literally seeing it all over the place. Billboards out on the street, seeing it on large posters, Facebook memes, all across social networks and on the television and newspapers, all over the place really. And I can understand that to an extent, given people are much more aware due to the alleged infectious outbreak of COVID-19 at the moment. They're much more aware of the potential risk to frontline staff like doctors and nurses and home carers. And so they're probably much more appreciative, therefore, of the hard work that the staff are doing. And I certainly wouldn't want to trespass on that recognition of the hard work and of the loyal dedication of so many staff members. Because I think, that is something that has potentially been neglected for a long time. I've met many nurses over the years who have complained to me, quite understandably, that often their hard work isn't always appreciated. The fact that they do very long hours, they often have to work lots of overtime, and they often aren't recognised and given that counselling and support for the emotional struggle and turmoil that they go through. Not just the physical hard work of the long hours, being on your legs all day, and that physical, walking around a lot, administering to various patients, but also the emotional struggle too, of witnessing and participating in people's struggles and seeing up close on a daily basis that suffering, seeing people struggling for breath, struggling to move in chronic pain, crying, distressed, seeing that on such a regular basis, and working amongst other people that see that and witness that on such a regular basis too. So it's the physical and emotional struggle. And I think, in fact, it's probably a good thing that we are increasingly more aware of those hardships that so many people have been enduring, but not just for the last few weeks, but that many have gone through for months and years, and in some cases decades. And perhaps we have neglected to give that the right appreciation and the recognition of that dedication and of that kind of struggle that so many have persevered and going through. And I think as a wider context, perhaps not just doctors and nurses and other frontline staff and paramedics and GPs too, but also the hard work of family members that are struggling to support other family that are very ill, the 4 million that are looking after as a carer, a family member, and particularly at the moment struggling alone, perhaps without so much support nowadays. The hundreds of thousands of care assistants that work in home care, supporting people to maintain independence at home, or the care assistants that look after residents in care homes across the country too, recognising that hard work and that dedication that so many have devoted their hours, their time and their energy towards, not just the last few weeks, but for months and perhaps years too. Perhaps we have neglected to properly acknowledge just how much support and risk that so many people have gone through over such a long period of time. So whilst I recognise that it can be a great thing that finally perhaps we can give some praise and recognition to so many of those staff that do endure such hardships, physically, emotionally too. But I do have my concerns, however, that we should be cautious about giving uncritical support to any large organisation that will have many good and bad things about it, as indeed all large organisations will do when they have such vast numbers that they are involved with. And that's true whether they are secular or religious or philosophical or scientific or medical or political or of whatever nature that they are. When it involves hundreds of thousands of people, or indeed in this case millions, then we're going to see a vast array of different experiences, and we would want to be able to give an accurate portrayal of people's different experiences within those vast organisations. Indeed, within the NHS itself, we know it's the vast monolithic institution. It's the largest employer of individuals within this country. It employs 1.5 million people. Within this country specifically, 1.2 million. A vast number, and of those, about 420,000 are considered frontline staff, that is nurses, midwives, doctors, GPs. So that's a huge number, and at the moment it's estimated each year about 10 million operations are carried out. Well, that figure's a little bit old, it's probably higher than that. That was estimated back in 2015 to 2016, and that saw in actual fact a 28% increase from 10 years earlier. So that averages out about 1 in 6 people, 1 in 6 civilians in the country are having some kind of hospital operation or treatment during the course of the year. I think there's probably a large number that are fairly healthy and don't receive any treatment, and there's probably a certain number of people that are receiving several treatments during the course of the year who may be perhaps critically ill. But about 10 million operations being carried out. Probably that's now a conservative estimate, I would guess. And of those, you would expect to find at least a few negative outcomes, even if we would hope the overwhelming majority might be positive. Well, there were some results done just a few years ago to try and find out what the public's experiences were within the NHS. In the 2016 British Social Attitudes Study, 63% of respondents were reported to be quite or very satisfied, whereas 22% reported to be very or quite dissatisfied. So it estimated then in that survey at least that 1 in 5 were dissatisfied with the service that they'd received in general, whereas 63% were satisfied. So there was sort of mixed results in that survey. A 2016 Care Quality Commission Inpatient Satisfaction Survey, it found that 86% of 72,000 asked rated their overall experience as 7 or more out of 10. So that's a fairly good result, I suppose. 86% had a fairly positive experience, whilst 14% had something of a negative experience. 84% reported that they felt they were treated with dignity and respect. 16% rather said that they didn't. 98% reported that they felt that the hospital was very or fairly clean, compared to just 2% that didn't. 70% felt that they were definitively listened to carefully by the staff, while 30% conversely felt that they were not. 56% in that survey reported that they definitively felt as involved as they wanted to be in agreeing to the care that they received. Of all the statistics, I think I find that one perhaps the most concerning, that only 56% felt that they were as involved as they really wanted to be in that care. So obviously something concerning that maybe there's more people who wanted more involvement, more information about the type of care that they were being given then. In April 2017, 95.8% of 205,000 inpatients said that they would recommend the provider that they received care from to their friends and family. So that's a fairly reassuring statistic, at least. I wouldn't recommend something that had bad treatment from, perhaps. 88.9% of 16,400 patients who were using mental health services said that they would recommend the provider to their friends and family. Slightly more concerning, that roughly 10% said that they would not recommend mental health services, perhaps due to some sort of bad experience or alleged bad experience, perhaps. From the same survey, 84% rated their GP's experience as fairly or very good. 82% felt that the GP had treated them with care and concern. 72% rated the experience of making an appointment as being very good. 66% stated their experience of out-of-hours GP services as good. And you can probably determine from the opposite numbers how many didn't agree with those. But obviously those were mixed kind of experience, but they generally seem to reflect my own experience in actual fact. And those that I would estimate from the people that I've encountered through home care, whether clients, other friends, my own experiences, myself, my mother, and people that I've personally encountered, I would say the general reflection from my own personal experience, and probably those of other people I've met, is that they're mostly good experiences, but with a sizable minority of occasions where they've not been as well. So I think, interestingly, those statistics actually seem to reflect my own kind of feelings as well, actually. But also, I think the personal anecdotes of those that I've kind of met over the years as well, of having mixed experiences, a large number and a larger proportion of good experiences, especially in terms of the manner in which staff treat them with the respect and dignity, but still some concerns about some of the treatments, some of the time at least. Well, now, there was a recent study done just a few years ago, a 35-page report sent to the government, in fact, and it claims that there were up to 850,000 errors that caused adverse effects for NHS patients during the course of just 1 year, and that those could have resulted in up to 40,000 deaths. That was a report by the then Chief Medical Officer, Liam Donaldson. That sounds like serious numbers, doesn't it? Potentially 40,000 deaths and 850,000 mistakes. But you have to look at that in the wider context, in the context of over 10 million different kind of operations or procedures, ranging from the very minor to the very major ones, of course. So as an overall percentage, that would reflect a small minority. Even so, if those numbers are accurate, then that's still something that needs to be addressed and is concerning. So I think it's obviously with a large organisation like that, you're bound to have some mistakes, you know, even if it turns out to be a small percentage. If you're having vast numbers of operations, that still adds up to a large number of people, doesn't it? So it's important to be critical in each case and to examine the reasons why those mistakes happened, so that we can look at whether those things could be prevented. So I think my concern is that if we have unwavering support for any institution, that kind of flattery can sometimes lead us to being blindfolded to looking at the real problems and concerns that need to be addressed, and where it's legitimate to criticise something, as indeed it is to be fair to all organisations and all individuals. You know, none of us are perfect and infallible. We can all make mistakes, but especially when we're overworked, under stress, and carrying out a large number of tasks over a long period of time, there's an increased risk factor in those conditions, and all the more important to realise and examine why things have gone wrong and where things can be improved upon. So that, just to give you some sort of some statistics from medical solicitors. They made a claim that up to 5% of hospital deaths could have been prevented. That's 1 in 20. Now, I don't know how accurate that is, or whether that information has been studied intensively. I guess that probably is wildly disputed. And I think we could all probably accept that there's probably some there's probably some margin of error. The debate would lie in how much that is. They also estimated that at that time in 2012, there were 1 case each week of a wrong site surgery. That's where the wrong part of the body is operated on. But I think that's probably an extremely rare thing that does tend to happen just very occasionally. Once a week sounds quite often, but actually if you compare that to the thousands of numbers of cases that take place each week, it probably is quite rare. But much more common is their claim that from 3 different studies, they demonstrated up to 15% of misdiagnoses of patients. But in actual fact, you know, some illnesses are much harder to diagnose than other things. So, you know, you can sort of forgive doctors struggling to diagnose some condition where the symptoms of something can be so similar and even mirror other conditions. Look at the case, for example, of Lyme's disease, where it's known as the Great Pretender because the symptoms that it exhibits are just so similar to many other conditions. It's quite understandable that it perhaps will be under or misdiagnosed sometimes. So even with the best will in the world, the most dedicated and well-researched doctors, you're bound to make some mistakes sometimes, just because you're often dealing with really complicated situations that are very often difficult to actually diagnose properly. There's a bewildering number of different and similar conditions, often with overlapping similar symptoms. So yes, it's worthwhile, therefore, looking into where mistakes have been made in the past in order to help aid doctors in the future to see where have things been tended to be misdiagnosed in the past, in the hope of helping to aid correct diagnoses in the future. This medical website claimed that 50% of paediatricians reported making 1 or 2 mistakes in the last month. Well, considering you're making a vast number of different decisions, that's probably not that surprising. And I suppose that depends how honest are they in reporting that information as well, how accurate is that information. But yes, you would expect people to make some mistakes. And, it's difficult to estimate or to get accurate figures, I would assume, on what the overall number of mistakes is, I would say. Now, just to go on, they also claimed that 1 in 7, that's 14% of medical negligence claims are made after adverse medical effects. If that claim is actually true, I find that a bit concerning, actually, that only 1 in 7 people that experience serious medical consequences as a result of serious adverse effects from medical intervention that went wrong, just 1 in 7 receive any compensation or are able to make a claim on that. If that turns out to be inaccurate, that itself is a bit concerning to me. I think, there's a tendency sometimes in all of us not to want to admit to fault in something because we can all be quite judgmental. And I think that's concerning sometimes in itself, because if we recognise where someone has been the victim of something, then we need to sort of like compensate them to help support them through any disabilities resulting from that, whether physical or mental. I mean, there are lots of different issues that people have with the NHS. You know, I can't go through the vast number of all of them, but just to sort of survey a brief range of some of the most important ones that I could see. In terms of mental health, lots of people have had concerns, sometimes with an over-reliance at times on medications, rather than also looking at possibly other things that can help, you know, occupational therapy, finding jobs and activities that can help support people to work and support people's mental health, finding support groups, counselling and therapy groups that can be supportive. There are concerns about the over-reliance on medication, also due to the potential of side effects as well. People are concerned about the underfunding of counselling and whether that might be a more adequate response for some psychosocial problems. The risk of pathologising an individual's legitimate emotional response to an abnormal situation. Consider a situation like grief, for example. One might be tempted to label that as chronic depression, in fact, but it's quite normal to be upset when you've lost a close loved one for a period of time at least. Or think of a child who may have a learning difficulty and struggle sitting in a class and focusing on an academic thing. Giving him medication may not be the best response. Finding an activity that's better suited to his cognitive and mental abilities might be a much more appropriate response. So there are concerns in that vector, in that sense. You know, there are concerns about controversial treatments, for example, especially the electric convulsive therapy, formerly known as electric shock therapy, that's still carried out on thousands of patients, both in this country, America, and in many other countries. I know that there's many doctors, patients, former patients, and family members of patients who have legitimate concerns about the potential neurological damage and the effects on the short-term memory of those patients that have endured such ECT alleged therapies, the effect that that might have on cognitive decline. So there are, you know, concerns about various aspects of mental health. But of course, you know, that's not to demonise all mental health and stigmatise it. You know, there are lots of good practices. I've visited mental health wards for many years, and I can vouch that the overwhelming majority of staff are loyal, hardworking, dedicated. They put up with a lot of abuse. They work in often difficult, compromised situations. They're verbally assaulted, verbally and physically assaulted sometimes. You know, they often lack or don't have the adequate support and training. And, you know, the situations that they are working in are very difficult, you know, with people that can be very volatile, with challenging behaviour, people that have got aggressive or violent tendencies sometimes, serious range of different behavioural problems. And I think wholeheartedly the staff do, on the whole, a wonderful, dedicated job. And I often don't see the recognition and praise of that hard work and loyal dedication that staff do. You know, counselling people throughout the day, you know, putting up with a lot of awful insults and abuse and having to sort of work with other staff to limit and mitigate that abuse on a daily basis. You know, there are sometimes, from my witnessing, working like prison wardens, really, where they are under often constant threat of this abuse. And seriously, in a hard, compromised situation, often on low pay, working long hours, and really enduring a lot of hardship. I've seen staff that are really work hard to be positive, upbeat, inspirational, and really to be there to try and give as much counselling and support to the patients that are in very hard situations. And you know, I think it's a wonderful job that they do on the whole. And within that context, yes, there are going to be some bad mistakes that happen sometimes. Absolutely. You know, and sadly, what happens sometimes is that you only hear about, you know, staff, you know, failing to get to someone, a patient assaulting another patient, somebody being over-medicated, somebody going a bit angry and smashing their arm through a window. Many incidences like that happen, sadly. You're dealing with large numbers of people with challenging, difficult behaviour cooped up in a small area for long periods of time. You know, it's an overwhelmingly difficult challenge that the staff are going through there. And of course, there are going to be incidents and lots of mistakes that do happen. But I think recognising those and where things can be improved upon is important, as well as looking at where staff have worked hard and showed tremendous spirit in being able to support people with an overwhelming range of different kinds of behavioural difficulties. That's just looking at mental health wards in general. And of course, due to the austerity recently, budgets have been cut, meaning that they're having to sort of look after ever more patients, you know, with ever restricted numbers of staff to do so. So that's made a ever more difficult situation potentially worse over the years. But of course, you know, there are lots of, that's my own personal experience, that I have my own concerns within the mental health sector. But I think a lot of people have other concerns within the healthcare system more broadly. There are people that have their concerns about vaccines, and it's a hotly debated issue, especially at the moment, what with the alleged